Alright, so my video on the integumentary system was too long for me to upload to YouTube, but I'm getting it on there. Okay, so the topic for this time, let me introduce myself again. I apologize. My name's Elena. I am taking anatomy, kind of struggling with it, trying to find new ways to study, so I thought maybe if I tried teaching it to people, it would really click in my head. So today's, or it's been the same day, right now's topic is going to be skeletal tissue. Basically, skeletal tissue, if you're going to think of skeleton, your bones. Exactly. You're right. Okay. The skeletal tissue helps form the framework of the body. The functions are support, protects viscera and movement, provides a site for muscle attachment, storage for mineral salts, and houses for bone marrow. Now, you have two types of bone marrow. The first bone marrow we're going to discuss is the red bone marrow. The color of it is from the presence of blood in the blood-forming cells. Blood cells at different stages of development are there, and there is some white adipose tissue, which is fat. So it's the only type in neonates, and it is active in blood production. In adults, your red bone marrow, is located in your flat bones, which are your sternum, ribs, clavicles, and parts of the os coxa. Also, proximal ends of the humerus and femur, which are your long bones. Main function, I don't know why I can't talk today, is hemoptysis, which is the production of blood cells. It's also the destruction of worn out erythrocytes, which are red blood cells, and storage in macrophages of iron from hemoglobin breakdown. Now you have yellow bone marrow, which is, the color of it is from the abundance of right adipose tissue, which, like I said, is fat. Most red bone marrow gradually changes into the yellow kind. It's present in cavities of many bones. It stores the fat for the white adipose tissue. It's not normally hemopathetic, but it can be replaced with red bone marrow if severe bleeding happens. Your bone histology, which is like the study of your bone tissue, your bone tissue is known as osseous tissue. It's a connective tissue, and bone tissue, of course, has a matrix, which is made of mineral salts, which can be hydroapatines, calcium salts, calcium phosphate, calcium carbonate. It also has ground substance, which of course is hyaluronic acid and chondroitin sulfate, and also collagen fibers. And also in the connective tissue there are cells. The cell types in bone tissue, first the osteocyte, that's the mature bone cell. It's encapsulated in a lamina of mineralized bone tissue. It occupies the lacuna. The filopoidal process of an osteocyte. It extends through the canaliculi, which is small tubular channels that radiate from lacunae. The processes of adjacent osteocytes are connected to junctional complexes. They can have intracellular flow of ions and small molecules from cell to cell, kind of like a bucket of grenade, like, hey, let's pass these cells. Yeah, okay. The maintenance of bone matrix is its function. Osteoblasts are immature bone cells. The function is to synthesize the organic components of bone matrix, which is bone deposition. Okay. Ground substance in collagen, osteoid. It's only on the surface of bone tissues. As they release bone matrix, cells become surrounded by matrix, and lacunae and caniculi form. So an osteoblast, you need osteocytes. An osteoclast breaks down the bone. They're large. They're only on the surface of the bone. They're for bone reabsorption, which is the breakdown of the bone. There's Hauschup's lacuna, which enzymatically is an etched depression. So I'm done stuttering.